July State Advisory Council meeting and policy development session. I wanted to start our meeting today to briefly reflect on the last year and some of the changes that we've made over the course of this year as a part of the SAC recommendations process. So for those of you who aren't as familiar with the process of developing policy recommendations for the State Advisory Council, we previously held a full day in-person session for the Early Childhood Action Plan Summit, where we celebrate accomplishments and the end of a cycle of work and re-energize our teams to set priorities for the coming year. It was also a really phenomenal opportunity where State Advisory Council members came together with Early Childhood Action Plan leadership and regional leadership, as well as families, to inform our priorities for the following year. And the process this year is going to be shifted a little bit for two reasons. The first is COVID and the fact that we are over 4 months into this pandemic. And I want to say thank you to everyone on this call, including the Building Bright Futures team of 13, as well as all of our early childhood stakeholders. I am so proud of this group for continually doing their best to support kids and families every single day, even when we are having a really hard time ourselves moving forward. So thank you. And I also want to recognize that we're shifting the process this year of developing those recommendations. So previously, ECAP leadership would develop recommendations and draft them and review them with the State Advisory Council, revise them, and then be approved by the SAC board over a series of a couple of meetings. And so this year's process is different because we're bringing all of our early childhood experts, agency partners, families, communities, committee leaders, and others together to talk about 5 key policy areas of importance that have arisen within the last year, and to use this full group as a brainstorm session to develop policy levers and recommendations in small teams, and then bringing it back to ECAP committee leadership for revisions. So today's meeting will have small groups, and we're using some new tech functions, so bear with us, but we're really excited to have these virtual rooms. And lastly, I just want to say before we start our mindful moment that I want to remind everyone on the call today that we have such an incredible opportunity to keep children at the center of all decision making and be leaders for the entire country in the state of Vermont by the work that we're doing here today and by supporting our youngest and most vulnerable children and families. And so what I want you to think about as we're in this space together today is coming together collectively instead of from our respective silos. So let's think about how we support kids and families without having our boxes or our silos. So that after we come to the end of this session and as we develop recommendations presented by the State Advisory Council, that we have one collective early childhood voice. So I'm going to turn it over to Amanda to do our mindful moment.
Thank you, Morgan. Hi, everybody. I am feeling the need to do some deep breathing today, so we're going to take about a minute. I invite you to turn your video off. And I wanted to share just a tiny bit before we jumped into the breathing. There actually is some research about the ideal rate for relaxed breathing. And that rate is a frequency of 5 to 6 breaths per minute, which basically means that you're going to hold a breath for a count of 5, both in and out. But that's pretty long. So we are going to build up to 5, and we're going to start in groups of 3. So we're going to take 3 breaths, counting in and out to 3 each time. So I'll lead you through this first one. Breathe in and count 1, 2, 3, and then let it go. Count 1, 2, 3. And try 2 more of those on your own. Breathing in for 3 and out for 3. Once more. Now we're going to try to build up to 4. So breathing in for 1, 2, 3, 4, and out. 1, 2, 3, 4. And try it again twice more on your own. And out. Now we're going to go for the magic 5. Breathing in for 5. 1, 2, 3, 4, 5. And out. 2, 3, 4, 5. Try that twice more on your own. Before we turn our cameras back on, do a couple of shoulder rolls, try to move that breath and energy through your body. And I welcome you back into the space.
Thank you, Amanda. I always find that moment of mindfulness so incredibly helpful before each of our meetings, so thank you. All right, I want to turn it over to Chloe Leary, one of the co-chairs of our State Advisory Council, to do some SAC business.
Great, thanks, Morgan. Hi, everybody. Nice to see you on this hot day. I'm going to go ahead and do the roll call, and if you're a member of the committee, if you could just unmute and say hello, and then other folks, if you could introduce yourselves in the chat box, that would be great. And I'm just going to go through my list because I can't see everybody all at once. So I saw Cheryl is here.
Yes, hi everybody.
Renee Kelly.
Yes, good afternoon everyone.
Hi Renee. Stephen Berbecco.
Hi, good afternoon.
Hi Stephen. Auburn Watersong.
Hi, everybody.
Hi Auburn. Ken Jones.
Yes, I am here for a while. Thank you.
Great, hi Ken. Brina Holmes or Janet Kilburn. Okay. Representative Brumstead.
Hi there, I'm here.
Jessica. Janet McLaughlin. Or Allie Richards.
Yep, Janet's here.
Oh, there you are. Hi. Julie Cadwallader-Staub. Emily Merrill.
Yes, hi, I'm here.
Oh, there you are. Hi, Emily. And Amy Johnson. Christy Swinson.
Yes, I'm here.
Hi, Christy. And then Flora Diaz-Smith.
Hi, everybody. I'm here.
Hi, Flora. Great. Thank you all. Did I miss anybody on the State Advisory Council? All right. So I'm going to move to the June minutes. Hopefully folks had a chance to see them. I would ask for a motion to approve the minutes. If anybody's feeling game from the State Advisory Council.
I'm happy to make a motion.
Okay, I think that was Cheryl making a motion. And can I have a
Yes.
second?
I can second. This is Stephen.
Great, thanks, Stephen. And I'm going to go ahead and ask for a vote. Everybody in favor?
Aye.
Aye. Sounded like a majority. No, I don't know. Anybody opposed? This is probably more important. And is there anyone abstaining?
Yeah, Ken Jones abstains.
Okay, great. Thanks, Ken. I didn't really ask if there were changes or discussion, so I'm going to assume there was not. Sorry, skip that step. But we have the June minutes accepted. Great. Thank you, everybody. And I'm going to hand it back over to Morgan.
Thank you. All right, so we're going to go back to our screen share. And before we jump into our policy recommendation development session, I wanted to go back and do just a minute of reflection on the vision for early childhood and talk through, where we are in coming to this work. So today we're going to start by reviewing some of the key challenges and data from the needs assessment that was just completed. This is not a comprehensive overview of the needs assessment. It's just pulling out the key themes and highlights. In our August meeting, we're going to have a full webinar dedicated to the needs assessment and the ECAP update. But the purpose of reviewing this data and our regional work is to understand how we use evidence to inform our policy recommendations. Today's meeting, as I mentioned before, also is the start of a new annual ECAP implementation cycle and how we are launching the recommendation process. And then most importantly, this time is about building connections. Again, really figuring out how we come together as a group, break down the silos that we've created in this system of services, and think about how we can connect the dots between our regional council work, our early childhood action plan work, and our state advisory council. Next slide, please. All right, so by a show of virtual hands, how many of you recognize this visual? And it's also behind me on the BBF wall. All right, so this is from the Building Vermont's Future from the Child Up. So back in a time where everything was named Building Bright Futures or Building Futures or Building Brighter Futures, you know, there was a vision that we still hold today as the Building Bright Futures State Advisory Council. And that vision is for early childhood to be an integrated, continuous, comprehensive, high quality system of services that's equitable, accessible, and improves outcomes for all children birth to age 8 and their families in Vermont. So you're gonna see components and pieces of those words in that vision. And if you haven't seen this actual document, I'm happy to send this image around with the minutes for today's meeting. But this is just a reminder that we have a very important vision to realize the promise of every Vermont's child. We also, next slide please, have adopted Vermont's guiding principles, which is really about supporting each and every young child's full and equitable participation in the system. So I'm not going to read through each of these different components today, but this is just a reminder to the entire State Advisory Council and all of our early childhood partners to be referencing this document. Please be reviewing the Vermont Guiding Principles, trying to understand how this body of work informs your own unique sector and your work with children and families in the state. This is something BBF is going to be leaning heavily on as we work on equity, diversity, inclusion, and social justice. Next slide, please. And this is just a visual reminder about Building Bright Futures and the State Advisory Council's role within this broader system of services. So our mission and the vision are likely not new to this group, but this is the first time we're presenting a new visual to describe our work as the State Advisory Council as Building Bright Futures. So you've all heard convene, monitor, and advise long before I came into the picture about a year ago, but in reviewing Act 104 and the Federal Head Start Act, so both our state and federal mandates to be doing this work, there are really more than 3 key charges that we have as Building Bright Futures and as the State Advisory Council. So the first is convening Vermont's early childhood community to foster coordination, collaboration, communication, solidify feedback loops, share best practices, and problem solve. We are also tasked with empowering families and communities and providing the opportunity for folks to lead and to elevate their needs. We are also charged with monitoring the system of services. So how do we know when families and children are doing well? And how are we ensuring equitable, accessible, high quality system of services? We're also tasked with responding to meet the needs of communities and filling the gaps for children and families at the regional and the systems level. And then finally, how are we using all of that information to inform and advise, and specifically to advise the governor and the legislature on the well-being and how do we use data to inform that decision making? And that's a part of what we'll be doing today. Next slide, please. All right. So most of you know that Building Bright Futures was tasked with completing Vermont's early childhood needs assessment this year. And that role and responsibility comes from 2 different activities. The first is the preschool development grant under activity 2. And that's a federal funding mechanism that has been awarded to the state of Vermont for a planning year that we are in the process of finalizing. But Building Bright Futures is also tasked with doing this role under Vermont's Act 104. So having a periodic needs assessment. So this is also filling our role under Act 104. And the reason you're seeing this visual today is also to say that we are consistently monitoring the system even beyond having a needs assessment. So one way we do that is through our regional councils and having them identify priorities at different times over the year. So the visual you're seeing here is the regional priorities as of April 2020. So this is something that we'll do probably within the next month and a half as we think about this next upcoming cycle of priorities. Next slide, please. Okay, so in terms of our data collection and analysis for this needs assessment, what I think is important for you to know is there were a range of ways we collected and compiled this data. One way is that we collected new data, and we did that through regional early childhood action plan forums and state advisory council forums. We also conducted a community survey, and across those new data collected, there were 160 stakeholders that participated across a range of sectors, which is really exciting. Vermont also conducted, or VBF conducted, with the help of Newmark, an unduplicated count of children who are receiving services. And one thing that's important for those of you who are really interested in data is that before this year, we did not have the ability to collect an unduplicated count, and we definitely didn't have the ability to collect it across our different service sectors. So the unduplicated count that we have available right now is within programs. So within Part C of IDEA, within Head Start, within publicly funded pre-K. But as of the fall, we will have the ability through the state longitudinal data system and in partnership with the Child Development Division and the Agency of Education to have an unduplicated across program count. So that is really, really exciting. And then the last way that we incorporated data for this needs assessment was reviewing our body of work collectively as a state. So we used data collected from Vermont for census data, reports from Building Bright Futures, the Child Development Division, Let's Grow Kids, as well as the Maternal and Child Health Needs Assessment. Next slide, please. Okay, so what you're seeing in terms of this slide is a very brief snapshot and the highlights of what we found in the themes for the needs assessment. Most of these themes are not going to be groundbreaking. We know this data, but this is the first time that we have the hard, raw data to inform our decision making for quite some time. So these are the top 7 themes, and what you're seeing under the examples is both a success or a positive component of what has gone well in the needs assessment and an example of a challenge or a barrier in most cases. So equity was one of the themes, not surprisingly, where 51% of respondents reported that the early childhood system works to embed anti-bias approaches in the program delivery. And then, you know, a positive is that Vermont has adopted the guiding principles, and we have been doing work in this area to move our equity work forward, but now we have the opportunity to take another step. The second theme was quality and accessibility. So here, examples of this data are that 62% of infants lack access to a childcare provider and up to 89% in rural areas. And then we have many programs that are really working to increase access and affordability. Not surprisingly, many of these data indicators are impacted or were impacted post data collection. So they may be different now that we are in, 4 months into COVID, but I just wanted to mention that as well. Another theme was the really complex and challenging early childhood service system and how we are or are not integrated. And so of respondents of the survey, only 5.5 rated that this system was very well integrated. But not surprisingly, everyone reported that the partnerships are really highly valued. People are really looking for leadership level coordination, intentional communication, and efforts to share data and to be talking and using data to inform policy. That being said, when we're talking about high quality data as another theme, only 21% reported that Vermont uses data to inform early childhood policies, and 16% reported that data are very high quality. So we do have some work in this area, but we have the opportunity to build. In terms of our workforce data, one example of the data collected here is that only 2% of respondents reported that the workforce is well equipped or very well equipped to meet the needs of Vermont's children and families. In talking about family engagement, 83% agreed that forming warm and trusting relationships with families is a primary strategy to engage families. And then the question for this group is, how well are we doing that right now? And how can we do it better? And then the last was funding. And so here's a qualitative quote to balance out some of this quantitative data. I'm not aware, or I'm not sure of any programming that's well resourced at this time. It feels like we're at a tipping point where everyone is working hard, funding has increased, but it doesn't come close to meeting the needs. And what we heard resounding across this needs assessment is that stakeholders are invested and recognize that creating a high functioning system is worth the investment. The only thing that you don't see on this slide that I want to make sure I mention is that there are a range of other surveys that are in process that are not included in this data, specifically a family engagement survey, a professional development survey, as well as a COVID-19 family impact survey. And that is just 3 out of many more. So I'm happy to talk a little bit more about this when we get into our small groups, but really what I wanted to share with you today is a quick snapshot of some of these facts and figures to inform your discussion as we move forward with developing policy recommendations. So now I'm going to transition to Beth to talk a little bit about the update to the Early Childhood Action Plan and the cycle.
Hi, all. So as you know, one of my favorite topics is to talk about our Early Childhood Action Plan. The Early Childhood Action Plan is a roadmap to ensure children are supported in their families, communities, and that we build a strong early childhood system in Vermont, particularly for the historically underserved and communities underrepresented decision-making. We have been underway to an update for this, this plan. The plan is built on the Early Childhood Framework, which was established in 2013. And our goal with this update was not to rewrite it totally, but to make it relevant and as useful as possible. I think the challenge with any strategic plan is a roadmap is only as useful as it is when you take it on your trip with you. If you leave it at home, it's no good. So we are really nearing the end of our update process, and I'm happy to share the 4 results that we have for this plan, which are, as you see on your screen, all children have a healthy start. Families and communities play a leading role in a child's well-being. All children and families have access to high quality opportunities that meet their needs, and a connected and evolving system. This is a slight revision from the original 6 goals, which, and we really feel like as we dig into the updated plan, you'll see that the content has not disappeared. We're just reframing so that we can really be clearer in terms of what our vision is and how to get there. As many of you are already involved, the Early Childhood Action, BBF has been charged with monitoring and holding the Early Childhood Action Plan, and we share that responsibility with all of you. We have 7 action plan committees that provide diverse statewide content expertise to the early childhood system, and those leaders and co-chairs will be kind of helping us through the small group process today. We are working to align and be informed by our 12 BBF regional councils to provide feedback from their own geographic area. And then of course be linked with this advisory council so that to the best of our ability, we are creating an aligned system. We work off of an implementation cycle, which has an annual cycle, and July marks the beginning and end of the cycle. And so that this is today's gathering is really in place of the day-long gathering that we typically have at the State House. And we felt like if we were to really synthesize down what we wanted to get is the connections that we benefit from on that day across our system, as well as really thinking about what do our children and families need right now. And so I want to, before I move on to giving directions for the small groups, I want to thank our co-chairs for these committees. We have 6 active committees and co-chairs. We have a policy of having 1 private co-chair and 1 public co-chair. And so I want to thank those of you. Why don't you raise your hand, give a shout. Thank you all for your time. This is work that folks do ideally as integrated as possible into your everyday work, but often it is late at night and in addition to the other things that you're doing. I am about to kind of dispatch us into our small groups. So in the registration process, we asked for you to indicate your preference for a small group. These small group topics were identified based on rising needs and opportunities that have come out of our regional councils and our ECAP committees. And those issues are, the first is COVID impacts on family economic stability and mental health. The second is chronic inequities and racism as a public health crisis. Childcare capacity and workforce development. Family voice to rebuild a stronger system. And evolve our data systems to address gaps. So I'm going to stop the share and start my video, and hopefully I have good enough internet. A true test to our new system at home.
I'm also going to just pause quickly to see if anyone has any questions before we jump into small groups. Okay.
Great. So what we are essentially proposing that we do today in small groups, which is slightly different from previous years, is that we're, in the past, we've asked for ECAP committees to bring policy recommendations to the State Advisory Council. And often that process happens much later in our cycle. And we saw an eagerness and a willingness and a need for us to collaborate much earlier in the process. So this year, we felt like this was the opportunity now in July to essentially workshop these ideas, these concepts. And so what we're going to do is we have an ECAP leader and a BBF staff member who will help guide us through the process for the next 40 minutes or so. And in small groups, you will be able to get some framing about what's happening. You know, many of us are already involved in these committees, though we did not, we're hoping that there's actually more diversity in these small groups than just the committee members, because we want to hear your voice. We want to hear what others have to say in terms of why is this issue important to you. And then the second question is, what's the policy recommendation or need or the gap that needs to be addressed? And what is the appropriate fit for BBF State Advisory Council to make a recommendation? Those recommendations, so essentially in your small groups, you're workshopping concepts. You may start with a brainstorm or the leader may come with a short list of things to start your conversation. Ideally, you through your conversation kind of winnow down what feels most pressing and what's the best opportunity for the SAC, which is a public and private partnership. And then those, and we don't expect that you're going to do any wordsmithing or any finalizing today. We don't need you to come back with a final recommendation at the end of these small groups by any means. We know that that takes work, and that work is likely done behind the scenes with a smaller group of people. So we will work on that with the ECAP committees over the next couple weeks and bring back recommendations that have bubbled up to the SAC in September. So that's a bit of the small group process. So, and as is kind of typical with new technology, we're doing our best. We figured we have this technology to break into small groups. We'll see how seamless it is. There are probably stragglers, people who have not been assigned to small groups, and I will stay behind in the gathering space, which I'll call the kitchen. So I will stay in the kitchen and reassign anyone who is not yet in a small group. I believe you do have the ability in the small groups to leave that small group. So if it doesn't feel like the right fit, you can come back to me and I will redirect you in our virtual space. Feels like Star Trek, right? Any questions before I dispatch into those small groups? Okay. So I am going to open the rooms. It's 2 o'clock now, and we are set to come back together at 2:35. So I'm going to send a heads up at 2:30 and then close the rooms shortly after that. All right, here we go. Okay, for those who are left behind, let's see as people are dispatched. I'm going to assign. Michelle Parson, which group do you want to go to? All right, I am silent because I'm assigning folks that did not get matched with their email, so hang tight.
Hey, Beth,
Yeah,
not letting me record it. You have to give me permission, I guess.
okay, I would go ahead without it. I have to assign folks, so hang on.
You can put me back in there then.
Okay. I don't see you on this list. Hang on. There's a lot of people who are not assigned, so I just hang tight. I will get you there.
Okay, no worries.
Flora, which group did you sign up for? It does not seem to have assigned you.
Childcare, and it was
Okay, there you go. And Jessica Brumstead, which group did you want us to go to?
The COVID group might be good.
Okay.
Thanks.
Tracy Collier, which group do you need to, would you like to be in?
How about the data group?
Okay, thank you. Stephen, which group would you like to go to?
The data group, please.
Awesome. Eddie Gale, do you want to go to childcare capacity? Is that right?
Yes, workforce, thanks.
All right. Adriana, which group do you want to go to? Okay. Who else is there? Speak up. Alyssa, Eli? Yeah. Oh, Robin.
I'm supposed to be helping Dora in the data group.
Okay.
This is Eli. Can I be put into group A, please?
Okay. Which,
COVID response.
all right. Thanks, Eli. Okay. Let's see. I have Michelle Parson, Courtney McCaig.
Could I do the workforce development and capacity group, please?
Okay. Who is that? I'm sorry. Courtney?
Michelle Parson.
Michelle. Okay.
Hi, this is Krista Watkins from Bennington.
Hi, Krista.
Hi, could I go to child care capacity and workforce development?
Sure.
Thank you.
3531. Thanks, guys, for hanging in there. Robin, you're not showing here. Why are you not being able to dispatch?
I don't know.
Courtney. That is weird, Robin. I don't even see you here.
I'm here.
I know I see you, but and Courtney, which group did you want to go into?
Economic stability and mental health, please.
Okay, great.
I'm sorry, I just joined. My kids are, it's very hot and exhausting. We went to the park and it took a long time. I apologize.
That's okay. Which group do you want to go into?
Me?
Yeah.
What do you mean group? I like I said, I just joined, so.
We are doing some small groups.
It doesn't matter. I don't.
Would you like to talk about family engagement?
What other topics are there?
Child care capacity. Data systems. I'm sorry, I don't recognize your name, so I can't.
Marta Hammond. My name is Marta Hammond. Emilia, 2004 is my daughter. I don't know why the Zoom is registering her name, but my name is Marta Hammond. I have a daycare of 16 years in Burlington.
Oh, that's great. All right, I will. You want to talk about the impacts on families of COVID?
Sure.
Okay, great. Thank you. Jay, do you have a preference?
Family voice, I guess.
Okay. Robin, can you log out and log back in? For some reason, it's not indicating, unless I dispatched you and you need to accept the assignment.
I didn't get asked if I wanted to do that.
Okay.
So I'll leave and come back.
Thank you. Adriana, which group would you like to be in?
It's not letting me leave there.
Who else? I have a couple more. Is that Lori?
Yep.
I'm sorry, Lori, did you say which group you wanted?
Yeah, if I could be in group A for mental wellness, COVID.
Okay, thanks for your patience.
Thank you.
This is Gretchen from Good Beginnings. That's the group I signed up for too, if you could put me in there.
Okay, Gretchen, you're not showing up here either. Let's see. Thanks for your patience.
That's okay. For some reason, I first got assigned to family engagement. I'm not sure how that happened.
It says you haven't joined. Oh, I see. So I can move you to COVID, you said? No.
Yeah.
What did you say?
Family, mental health,
Yes.
family.
Okay, great. Gotcha. All right. Who else? Katie, do you want to be in a small group?
Not really. I can stay in the kitchen.
Okay. Adriana, are you still on?
The chat, Beth says that her mic isn't working, and I just asked her which group would she like.
Okay, thank you.
You're welcome.
Our best laid plans, you know. And then there's a number, 5723. Who's that? So Gretchen, if you can still hear me, you're going to have to accept the assignment.
I don't. Yeah.
I see that I've sent you to the.
Oh, okay.
You got it? All right. Awesome.
So, Beth, do you see Adriana would like to go racism as a public health crisis?
Thank you very much for your help. Okay. Now there's Gretchen still. Oh, there she goes.
One person left.
There's Robin.
Oh, there's Robin. I'm going to send her to data. Hi, Robin. I see you're back. Can you hear me?
I can hear you.
Okay, so Robin, I'm going to assign you, but you need to accept the assignment.
Where is that going to open up to accept?
It'll probably flash on your screen.
Okay, it's never done that before. So
Okay, or look at the bottom.
Oh, well.
Okay, let's try it. Okay, so people needed permissions to record. I don't know if I can do that. Let's see.
Nice job, Beth.
I respect your grace under fire.
I know, I wish I could.
I would have been like so visibly shook trying to do
wish
that.
there's something I can do.
On top of that, while I was talking, my internet went fuzzy. Was it delayed on your end? That's why I took my video off. Because like right as I was about to talk, my family came home. I was like, oh man, now this means that there's going to be a drain on the system.
Oh, right.
Right.
Welcome back.
Thank you.
All right. Do we have everyone back? Fabulous. All right. Well, thank you for that tech experiment. I give us maybe a C. We'll see. Room for improvement. Awesome. Well, I am sorry to cut your conversations short. The good news is that if you like that conversation, there's more of that at the ECAP committees, probably, or elsewhere. So I can't wait to hear. I did pop in and out of some. But we would love to hear, you know, what emerged from your conversations, as this was kind of a wayfinding conversation around emerging issues and what kind of statement or policy recommendation can leverage change right now. And would love to hear highlights from each group. Would the COVID impacts on family economic stability and mental health be willing to go first in sharing a highlight?
Sure.
Thank you, Chloe.
I will jump in and then ask for anybody to say what I might have missed. We shared actually a lot of bright spots that this virtual world has made services and groups and access to each other more available. So people had examples of parenting groups and sort of an ability to connect. Although we did identify that dead zones and technology, access to technology is maybe one of those areas to really, again, magnifying something that was already a problem in Vermont. So definitely some bright spots that felt like they were working, and then the challenges around really worrying about you know, some of the pressures with the school conversation and what that means for families and kids and providers. So you know, for in early childhood, for providers who have kids with special needs. You know, getting supports from the school system can be challenging. I think just really a focus on keeping an eye on things and using the systems that are in place and trying to share that learning seems hopeful, but yeah. So I think there's still a couple ledges to go over, I guess I would say. So hopeful conversation and definitely acknowledging the challenges. And I would invite if there was something that popped up for anybody else that I didn't cover in that.
Thanks, Chloe. Yeah, are there others who were in that small group that want to add anything?
I was just going to add that we did have a home provider in our group with us, and she raised a good point that they are feeling kind of left behind. So to carve out space for their voices in these conversations so they don't feel like they're in the dark, and when they need to reach out and ask for clarification, they know exactly who to go to and who to turn to.
Thank you. I think that the question is from here, if the SAC is going to make a policy recommendation, how to take an issue that feels this big and make it manageable. Great. Is there anything else? Okay. I am going to move us on to the next group, and not to rush anyone, but just giving space. Why don't we move on to childcare capacity and workforce?
All right. Our group had a wide-ranging conversation, and I think there was both the feeling that there is we're at a place where potentially we can really seize the moment. There's this sort of unprecedented awareness of the importance of childcare for kids and for our economy, for our public health response. And and this is, and it's also a place that has sort of right now, right, the actual sort of interconnection and integration, between, what's happening in schools and what's, the solutions for K-12 and the solutions for childcare, like that we see that, right, they actually are very, like they actually, in practice, they are integrated, right? And what's happening in one impacts what's happening in the other and vice versa. Even if that's not necessarily the way our policy looks right now. And so how can we, make sure that we're, making sure that, kids and families and communities are really at the center in a way that feels more integrated. And then we did also talk about a lot of we got into, I guess, more specifics on both the big picture level and on the really specific level. So in terms of specifics around, if we're thinking big picture, like what does this mean for universal pre-kindergarten? Should it be expanded? Should we be thinking about, what's the role of the healthcare system in supporting early care and learning for, infants and toddlers? And then, how do we think about our, the schools, facilities in our communities differently, as well as really other specifics that are really related to right now as programs are, just trying to get a sense of what's happening with their staff. Are people going to be available or they're not going to be available? What's happening with parents? Are they going to want care? Or are they going to not want care? As we think about preparing, for the workforce's immediate needs, as well as even 2, 5, 25 years down the road, what are the systems that need to be put into place there? So it was a pretty wide-ranging, I would say it was a pretty wide-ranging conversation, but with sort of the theme that we need to, even while we need to be problem solving right now, that we need to be, bold about really living into the vision that we have for childcare that had been laid out in the Blue Ribbon Commission.
Thanks, Janet.
Summary via 8 Post-it notes on my desk.
Yeah. Good job. All right. Well, how about the family group go? Family Voice to Rebuild a Stronger System. I don't know if Hillary or Jen, who is going to make a report out.
We didn't really assign someone, but
Okay.
I'm feeling particularly grateful for Cheerios at the moment.
Yes,
as
you
I
have a helper.
my 1.5-year-old here. I might lean on folks in the conversation
Sure.
to add in things that I miss. But we spent some time talking about sort of where our Families and Communities Committee is at, and some of the structures and sort of meeting norms and processes that we are hearing from parents about putting into place that really allows for meaningful and responsive engagement. And so we really talked about just sort of some meeting structures and how incredibly important it is to have parents in formal leadership capacities, that the structure of a parent co-chair is critical, and also that more Cheerios, that having our committee be made up of majority parents allows for also a different level of engagement, and the importance of what partnership looks like from a provider standpoint, sort of how we step up and step back in response to what parents' needs are, and feeling really appreciative. We are in the process of creating a form that's sort of a true reflection of our committee's working together and our goals, and so some folks in the group provided some great feedback and some suggestions around that. So I don't know if there are some other folks that were on that call that want to chime in. I'm losing my partner here, so I'm going to mute myself.
Thank you, Hillary. It's a very energetic group. All right, we are excited where that committee is going and that work. Does anyone want to add anything? I'm going to call on the data
Can I just,
group.
hey Beth.
Yep, go ahead, Renee.
Can I just hop in? So it didn't hit me until we came back into the big room and you kind of framed us about policy recommendations. And I would love to see any policy recommendations that are created through these processes and within the SAC actually go to the Families and Communities Committee for review. So now that we do have that more than 51% parent and family membership, we can actually get some family eyes on those recommendations to really speak to what does this mean to families? Is it relevant? Are they supportive? Do they see any gaps? I think it's an opportunity to take the training wheels off and really get some solid input from our fantastic group of parents and families about what do these recommendations mean in a day-to-day level and in their daily lives.
Great idea. Thank you. Okay. How about our data systems group?
So I'm gonna try, and then whoever sees that something's missing can fill it in after. We went big picture and said that we hope that Vermont will invest in a unified data system for all of Vermont, not just the early childhood system, but all of Vermont. What are some smaller steps that we can take along the way? You know, thinking about the Early Childhood Data Governance Council, that has been something that there was a lot of work put into, and how can we use the information, how can we use that to get it restarted, and what is that going to look like? Probably ensuring adequate staffing, making sure that there's some level of investment, both personnel investment as well as financial investment. And then, you know, thinking about, you know, when there are new data systems that are being purchased or implemented, that they are, you know, that they are coordinated within themselves, And, you know, at the, again, sort of one additional step is making sure that in the short run and long and beyond, that we are really trying to align our data collection. So when we're thinking about it, not the not the monitoring or the regular data collection, but when there are surveys going out about family experience during COVID, let's make sure that we're working together so that we have one really good survey that's going out and instead of 7 different surveys. And you know, at the Data and Evaluation Committee, there was a great, CDD came to the table and got input, which was a great step. And so like, let's be trying to have that happen more often moving forward. We can give it more weight if it's got more of us behind it, as well as having higher quality and the resources. What have I missed?
That is really exciting.
There was one other thing, which I'll just say that Tracy brought up, that it's really important for everyone to be invested. So it's a, you know, when we're talking, like, it's a case management system that's actually useful. So it's not just a reporting system, but it's actually something that is providing benefit for everyone. So
thank you.
Small goals.
That's great. I love it. Okay, and we are going to move on. I think our last group is chronic inequities and racism as a public health crisis. Karen, do you want to lead us off?
Sure. So Morgan Crossman, myself, Becky Millard, Darla, and Adriana were in this group, and I think had great conversation, bringing different elements from different places that we're sitting. So Morgan kind of started us off by having us read and review the BBF statement of diversity, equity, social justice, and inclusion. I wanted to get it right, which I think was great to remind us and kind of ground us in that, and then what were some of our kind of responses to that, and then, you know, kind of what are we seeing, hearing at other tables, BBF, certainly specifically, but not just, as to what we're seeing around these things. And so, you know, I think we covered a lot of ground. I'm not sure that we came up with anything really kind of specific or tangible at this point, but I think, you know, we were talking about, you know, one of the things I shared was the conversation we had in the Early Childhood Wellness Committee last week around challenges around health disparities and health equity. And, you know, that I think one of the things that committee that seemed to really resonate for that committee, I think, was, you know, really focusing in on social determinants of health and talking about kind of health disparities, but also really looking at what is health equity and what does that mean, you know, kind of coming from that perspective and really looking at what's happening, what's been, you know, again, I think Chloe might have mentioned it in her report out, but, you know, that what we're seeing is a real bearing of really fundamental inequities that have been going on for a long time. COVID has kind of uncovered, or, you know, had people have to look at in ways that maybe we haven't before, not to, you know, and to be able to respond to those things and respond in more innovative ways, to be able to respond and move beyond barriers that, you know, that we've all experienced. You know, whether barriers for families have been really removed, I don't know, but you know, that's a lot of, I think, what we were talking about. that it reinforces how important supporting young children are in being able to shift things within systems. So those were some of the things that we talked about. And then I would look to Morgan and Becky and Darla and Adriana to see if there's anything else you would add.
You know, one of the things that I think that we talked about a little bit is that there's a lot of existing work that's already been done in the equity arena, and how do we bring that forward? I know Beth and Becky and some others have been really involved in developing tools or pulling together resources to develop tools and workshops in the equity arena. And is this an opportunity for us to make some formal recommendations about how we as an early childhood system are using the tools that we have created? How do we bring that work back to the forefront? And then how do we do a better job partnering with and aligning with existing task forces and groups in the state and nationally that are doing this work well and are experts in this arena? How do we bring them into the early childhood world and learn from each other and start doing more of that cross-sector and cross-agency engagement and alignment? And then the only other thing I wanted to mention is a comment, and Becky, I'm gonna specifically call you by name here to say I really loved a comment you made in this group and thinking about dynamics, power dynamics, and thinking about the importance of our collective voice. So not specifically within this specific bucket of recommendations, but we often think about power dynamics as challenges and as bureaucracy. And what I want to urge this group, both as the State Advisory Council, but also as a collective group of early childhood stakeholders and leaders across the state of Vermont, is recognizing the importance of your voice within your organization, within the system, and that your voice is part of this SAC and is powerful. And it's powerful in this context, but it's even more powerful when you take the work that happens at this SAC, take the recommendations and bring it back to your leadership within your silo, within your sector, and use it to actually create change there, right? You know, we talk a lot about developing recommendations, and we don't want those recommendations just to be printed in the How Are Vermont's Young Children and Families report. We want you each individually and as organizations to see yourselves in the programs, in the recommendations, in the priorities that we're developing, and then take those and advocate with your leadership, whether it's the governor, the secretaries, the commissioners, program directors, your communities, because we have a real opportunity to create change right now, even more so during COVID, where we're feeling empowered to push the limits and actually create real change for kids and families. So I just wanted to reiterate that to the full group because I thought it was a really powerful statement.
Thank you. Well, we have taken quite the tour of issues facing children and families and the system, frankly. Clearly there's a lot more work to do, but I think it's fascinating, you know, what we can do in a short amount of time. And there's clearly more work to be done. So thank you all for your kind of navigating through what might not have been very clear, but that an issue that certainly is issues that are arising and that we want to make statements and really be able to impact. So I'm going to do a screen share just as we really come up on our time together. What are our next steps?
Before you go to that, can I just make one quick comment overall about the needs assessment piece? I think it's really important when we start talking about it with others that are outside of our group, so other legislators and policymakers in general, that people really understand that when we talk about those needs that were brought out in those groups, they are not COVID related. Do you know what I mean? Like I'm a little bit concerned that right now, all we're talking about in that sort of ether is all the things that have happened due directly to COVID, the bad things, the good things, the how are we getting out of this mess, all of that stuff. And yet you all have done a lot of really good work before all this happened, right? And now you're getting ready to present it. But I don't want people to take it and say, wow, I'm surprised that childcare and, you know, blah, 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 didn't mention COVID, or that this is what they prioritized as the biggest needs, when people are feeling like right now the biggest needs are what is happening with special needs kids in our environment because the Agency of Education isn't helping out. You know what I'm saying? Like there's, I'm just worried that you're on a track that we were on because we were told to be on it, and then all of a sudden this big thing sort of dropped in the middle of it, and we have to make that super clear to everyone that we put this information out to.
It's such a great point, Jessica. I really appreciate you raising it, and I realize that in my framing of the needs assessment, one of the things I neglected to say is that the needs that came out in this needs assessment were not new. These are gaps that we've seen, and that COVID has just widened those gaps, right? So during this COVID pandemic, we actually made a decision not to redo the needs assessment and not to do another survey, because what we heard so clearly across the board is that we aren't seeing new gaps. We're just seeing the gaps widen. We're seeing the challenges even more clearly represented and data to reflect those needs. So I really appreciate you saying that, and it's important as we think about the framing.
Because even IT was big before, but boy, now it's huge. And we all know that, but the other thing we know is there's no money. I mean, we're going back into session to see what the huge revenue loss has been. So anyhow, just thank you, Morgan, for saying that. And I just want to make sure that I too keep that in mind as people ask me about this process. So.
Good point. Thank you, Jessica. So we are nearly at time, and so I just want to highlight a few next steps. First of all, to invite folks to ECAP committee meetings, to regional council meetings. Everything is virtual right now, so you can literally travel the state without leaving your computer. So if you are wanting to understand kind of what are the conversations happening at these different tables, you are welcome, you are invited. The work then the discussions that you had in the small groups will continue. We will synthesize those ideas and identify what feels appropriate and rising up as a policy recommendation. And those that do rise up will be presented to the State Advisory Council on September 28th. And eventually be included in the Howard Vermont's Young Children and Families report, which will be distributed in January this year. And for those of you who are really excited to kind of dig into the needs assessment, we will explore that further, as well as kind of more highlights from the updated Early Childhood Action Plan. We plan to do that webinar style at our August SAC meeting, August 24th. And then the last request from you all is that over the last couple months, we have presented performance measures and survey questions to help BBF measure our impact, and we are going to finally distribute our stakeholder survey. So that request is for anyone who's on this call, all BBF Council members, people who receive Regional Council emails, ECAP committee members. We very much want your input, so that will come out shortly. So thank you for joining us today. It's been an adventure today. So thanks for your patience and engagement, and we will see you soon.
Thank you.
Bye, everyone.
Thanks, Beth.
Bye, everyone.
Thank you, everyone.
Bye.
Bye, guys.
Thank you.